Welcome to another episode of Preparing for the Unexpected. I'm your host, Alex Fullick, and as always, we like to talk about things related to disaster recovery, business continuity, COVID, resilience, anything that's relatable to those topics, and anything that helps you, your organization, or your community prepare for, respond to, and overcome adverse situations. If you'd like to be a guest on the show, you can reach out. You can find me on LinkedIn. I'm the only Alex Fullick there, so I'm really easy to find. Just send me a message. Let me know what you want to talk about or what you'd like someone else to talk about. And we'll see about getting you on the show or finding someone else to come on and talk about the topic you'd like to hear. I'm going to jump in to our conversation today with Regina Phelps. Welcome back, Regina.
Alex, as always, it's a great treat, our monthly chat.
And there is so much to talk about. I know we just have to kind of jump into this. I know we said before we started recording that may you live in interesting times, and both of us agree we're kind of done with the interesting part already.
Right. Yes, I think as we were saying, between the war in Afghanistan, the UN climate paper that came out, and the surge in Delta, I'm kind of done with interesting, and I would go for a big boring about now.
Yeah, me too. I agree with you. I would much prefer that. So I know you've got some things to tell us right off the bat. How are things where you are?
Well, on that note, I'm going to show my slides because I just would like to, just because it's easier. There's just so much, frankly, going on. It'd just be easier if I could show my slides than to actually verbally talk through this stuff. So, the question is, where are we right now? Wow. I wish we were in better places. And given the amount of vaccine that we have in the United States that still, unfortunately, is in refrigerators, we're still in kind of a lousy position. I mean, this is the map of the U.S. And if the red indicated gangrene, I think Florida and the whole southern part of the United States would literally fall off into the abyss.
Yeah, that's quite the just solid dark in quite a large swath.
It is a mess. And what I would say to you, to your listeners, the New York Times, this is their particular diagrams I'll be talking about over the next few slides. They have a really good, digestible process for really taking a lot of data and putting it into something that we can all understand. What's been interesting in watching this map is that all of the southern part of the United States has been lit up for about almost now 4 weeks. Texas, all the way across to Louisiana, Mississippi, Alabama, Arkansas, and then down into Florida, which is now almost completely red. But now, interestingly enough, here in the US, we've seen Oregon and Washington in the areas that are not well vaccinated. So in the upper Northwest, also beginning to light up, which is new. Nebraska, by the way, does not provide any data to the US about what's going on with COVID. So it's a big unknown, and that's why their state remains white. Here in the United States, public health is managed at the local and state level, and many states can do what they'd like to, and that's what Nebraska's been doing with their data, which is interesting. Here's where we are today. So here in the US, looking at the 7-day rolling average, we have been having, it's actually now 139,872 cases. The last time we were about at this level was about the middle of October on our big climb up in the winter surge. So this is the highest we have been since really the last big winter surge. And, it's tragic. The hospitalizations have really gone up, about a 60% increase over the last 2 weeks. We're at 83,000 people in the hospital, and increasingly numbers of individuals who are younger, between 20 and 50 years of age, and children. And in fact, for example, in Texas, there are no ICU beds for kids, with numerous kids on ventilators and ICUs filled. And not just Texas, to be honest with you, but all over the South. It's very hard. If you're in a car accident, you have a heart attack, getting an ICU bed is really, really tough. And our deaths have
I
gone
heard
up.
that on a news report actually earlier today.
Did you? Oh
And I
gosh.
think it was either Louisiana or Alabama. And the person said, I dread someone coming in from a car accident, cancer. And then there was a third one that she mentioned. And because we don't have anywhere for them, we don't
Right.
have a single bed available in this state.
That
And
is,
my jaw
that's
just dropped
horrifying.
going, oh my God.
It's horrifying. And that's what was always foretold, was that this could actually happen, that we would actually have no ICU beds, and in some communities, no hospital beds. So this is a huge, huge issue. And many people have had to delay elective surgeries because there's no space for them. There was an article in the Washington Post just yesterday about a man who was shot in a drive-by shooting, has been in the hospital in Texas for 10 days, and they have not been able to do surgery on him simply because they can't spare the staff, et cetera, to do that. So they've been stabilizing him and waiting to do surgery. 10 days.
Wow.
Oh my God. Right.
And that's almost a story you would hear in a third world country, and no disrespect to anybody, but that you would not think you would
Absolutely.
hear that in the United States.
Right. Right. That's the part that is really quite horrifying. Our death toll has gone back up dramatically. And again, as you probably well know, that hospitalizations and deaths are a lagging indicator. Most people really start to get sick around 10 to 12 days post positive tests. So that's when the hospitalizations go up. And then about another week after that is when people start to die. And so as you can see now, we were actually almost at 700 deaths yesterday. And that's, again, stunning, absolutely stunning. So we are, unfortunately in terrible shape. And as you can see at the top right-hand side, we still only have 72% of our population that is actually has at least one dose above the age of 18, and 62% are fully vaccinated. So again, we have a long way to go, and we have all the vaccine of here in this country, and yet we still are not getting the needles in people's arms, which is really, really tragic. And this really gives you a really good sort of summary by looking at all of these key indicators. We have the highest rates of cases, as I mentioned, since the big drive of winter last year. Hospitalizations are now at the highest they've been since literally the winter of last year. We're again close to 700 deaths. We haven't had that since the winter. And deaths, remember, are lagging indicators. So I'm expecting that this is going to bounce up here in the next 2 to 3 weeks. And that now we're seeing this big rise in the Pacific Northwest. So, I wish I could say to you, Alex, that your southern neighbor was doing better, but I can't say that. So please enlighten me. I hope you are doing better in the north. Okay, there's no pressure, Alex, but I hope you're doing better in the north.
Well, I wish I could say we are doing better, but I think it's a fact now. Everybody is in a fourth wave. It's not a potential wave. We are in a fourth wave. Up here, how do I say it nicely? Basically, across the board, everything is starting to trend up. In the province of Ontario, where I live, we had 6 or 7 days in a row of 500 new cases being reported every day. And then
that is a lot for you. That's a lot.
That was a lot. And we have a very large percentage. I keep looking at the Canadian numbers, so I can't remember the Ontario number, but we have a very large percentage of people that have been vaccinated, and they're still ending up in the emergency wards. However, what's interesting is the region where I live, just west of Toronto. I was listening to the radio earlier today, and of all the cases they're getting, 97% are related to the Delta variant, and that 97%, those people have not been vaccinated. They don't want their vaccination, or whatever the case may be. But that's who's making up the big bulk. Our deaths are nearing 27,000 now for the country. But it's now starting to tick up. slightly. It's not to the degree of what you telling us of what's happening in the US, but it is starting to tick up here. Hospitalizations are up, active cases are up. Um, and to your point with deaths, because we're not sure, all these cases are being reported right now. We're probably going to see a big change in that number. I hope not. But we may see a change in that number in a week or two, where it might drastically start to go up. I'm hoping not. And you're mentioning children, and there's, and we may talk about this later as well, but there's a big fuss now about should we put a halt on school openings and university openings and stop the progress of reopening things right now, so that we don't end up with reliving what we went through in the fall and winter and spring of 2020 and earlier this year. So overall, it's a bleak picture at the moment. However, there was a very interesting story I just wanted to convey. On Facebook, I noticed that a cousin of mine who lives in Alberta was here in the Toronto area, and they noted that everywhere they went, people were wearing masks. Every restaurant, every store they went in, they were asked, where have you been? What are you doing? They took their phone number, address, great. Everywhere they went, everywhere, in case, and a contact number in case, somebody else in the restaurant or the store was identified with COVID. They can reach back. And then they went back to their own home in the province of Alberta, and it was like night and day. They weren't going through the same things. They weren't asked the same questions.
That's interesting, because I always think that you're different than America, because America is is exactly the same way, the place of two worlds, right? So you can go to Texas, Louisiana, Florida. They don't, y'all come and it's all great. And in my city, people haven't stopped wearing masks in San Francisco. And so I just that's so fascinating that you have that same exact behavior in your fair country.
Yeah, and Toronto, you can't go anywhere without a mask. They won't let you do anything. No mask, don't even come close to us. Don't even think about it. And then he went to his home province in Alberta, and it was a completely different atmosphere.
Wow. What's fascinating about this, that your experience that you're sharing about Canada, because your vaccine numbers have really increased rapidly, just in a short period of time, right?
Yeah, we were really far behind on, but now we're over 64% of people with 2 doses, and we're over 72% of people with 1 dose. And go ahead.
And it wasn't that long ago that you guys were in the teens. I mean, literally,
we were way behind. We were way behind the US. We were way behind everybody.
Right. Yeah. Well, what's fascinating to me, based on what you're sharing and your vaccine rates, just here in San Francisco, for example, we have about 80% of our population that has had 1 dose and 77% that's had 2. Really, really high, right? So very close to 80%. We are still having a surge here, where I want to say the vast majority of people, even walking down the street, have a mask on. And what that says a lot is about the infectious nature of Delta, that you can be in a place where there's not that many people who could get sick, and by gosh, they're getting sick. We had literally 15 cases a day for months, and now we're up to 300. We had 8 or 9 people in the hospital. Now we're up to 125. And yet we have a very, very high, if not the highest, vaccine rate in the United States, with great care when people are out and about. So that says a lot about the infectious nature of Delta, but it also says how much we're going to have to really work to really get our arms around this thing. And it's going to be 90+% vaccine that will make the difference. And if not, then we're just going to be living like this for probably quite a while.
Well, I'm hoping that a lot more people, and then we're going to touch on it, but I'll just mention it quickly here, that will start getting their vaccines very soon, because we're starting to see in the news, and I think you're going to bring this up in our next segment, that all kinds of organizations, and at least in Canada, government agencies and departments are saying you have to get vaccinated, period, or
Right.
too bad. And surprisingly enough, today, the Premier of Ontario, same thing as a governor down in the US, for anyone who doesn't know, mentioned that there were two people in his cabinet that haven't been identified as fully vaccinated.
Mm.
He told them, you have 48 hours to make a choice, get vaccinated in those 48 hours, or you're losing your position.
Wow. I'm impressed.
I was
This is-
impressed when I heard that too. It's like, well, good for you.
That's great. That's great. I mean, people need to be a role model, and they need to move forward, and everybody needs to get vaccinated. And your leaders, our leaders, need to do exactly the same.
Yeah, I was impressed when I heard that. And his reasoning was, you're working for the government, you are elected by the people, you are working for the people, and you cannot intermingle with them, in your post and not be vaccinated in these times. It's irresponsible. So you either get vaccinated or goodbye.
Impressive.
So I was impressed to hear that. And on that note, we've come to the end of our first segment. We are talking with Regina Phelps today about all things COVID, and I know the next couple of segments are going to be a little tough, but we'll get through it, I'm sure. We'll be right back. Welcome back. Today we are talking with Regina Phelps once again, and we are talking about the latest happenings with COVID. And Regina, the next part of what you want to tell us isn't quite as rosy, I guess I could say.
Yeah, I guess that rosy would not be the word I would use to describe it. I think we're at that moment in the pandemic where I think it's really important that we kind of stop and think about what could happen. Now, I will tell you, Alex, that even the smartest and brightest epidemiologists and infectious disease docs, I mean, none of us really know what's really going to happen. There's a lot of theories about what could happen. There's some concerning things, though, based on science that could actually occur based on the fact that we have vaccines rolling out, because still, like here in the United States and in Canada and around the world, we have a lot of people that are partially immunized. We have people that have immunocompromised conditions. And now with this rapid spread of Delta, which is a much nastier version of the earlier versions of the virus, that we have a lot more things that we can be concerned about. And I want to just share some things because my clients constantly ask me, and one of the things I spend a good part of my day on the phone talking about is, well, what do you think is going to happen? Or what are the scientists actually looking at? And so I do have some potential things to consider when we are looking to the next few months based on Delta, the spread of Delta, the transmission of it, the fact that it's being able to more effectively infect vaccinated people, and what this all means. So I want to talk about that, and I want to talk about the potential of the emergence of vaccine-resistant variants. So what do I mean by that? So right now we are in a really ripe condition for the emergence of vaccine-resistant variants, and it's really because of three reasons. One is that a lot of people are partially vaccinated. So you were just mentioning that you had people that you were aware of or you'd seen in the news that because of their positions, they were partially but not fully vaccinated. We know from the research already that if you got Pfizer, for example, that about 33% of the effectiveness of that one dose, if you only got one dose, it's only 33% effective against the variant. But if you get two doses, of course, it ramps it up to exceeding 90%. Now, when you are partially vaccinated, one dose of Pfizer or Moderna, what happens is that you can become infected much more easily. And while you're that virus is inhabiting your body, what's happening is it's constantly attempting to reproduce. And because it's a little harder for it to reproduce as it would in a person who has no vaccine at all, what can happen is this kind of continue over and over and over as it's trying to reproduce, what can happen is that it can begin to be more creative. It becomes to throw new possibilities in its reproduction, because the virus itself is not a very good copier, so it's always making mistakes. But when it's trying to live, I remember that's the whole deal, right? It's trying to surpass itself over the vaccine protection that you have in a partially vaccinated person. It can become more and more creative, and when it does that, there's always the potential that it could actually create a new variant that is going to be more effective at getting over the protection of a vaccine. So that's a big concern when we have lots of people that are partially vaccinated. And here in the United States now, people are increasing their vaccine rate, but you have to wait, as you know, for a period of several weeks after your first dose to get your second dose, and then you're not fully vaccinated for about 6 weeks. So during that time, these individuals could start to create a situation in their body where that virus is actually reproducing and trying to overcome the vaccine. So that's one group of people, the partially vaccinated. The second group of people, about 3% of the people in the US, and it's probably similar in Canada, have some immunocompromised immune system. Which means maybe they're on cancer treatments and therefore it's suppressing your immune system. Perhaps they have a transplant. Really, one of my closest friends has got a double lung transplant. He can't make any antibodies. And so he's had 2 vaccines and he actually has made none. So because they don't have a very good immune response, they're very similar to those individuals who are not fully vaccinated. So this is what's called incomplete viral suppression. So you can't really push down the virus. So what happens is it has this ability to mutate. And so we are now in a very dangerous position because of partially vaccinated individuals and these immunocompromised folks. So that's the first thing that we should all be thinking about, like, wow. So that's why if you know people that aren't fully vaccinated, they need to get it.
A lot of people that I know now are fully vaccinated. At least everybody in my bubble and my family, everyone is fully vaccinated. So at least personally, I'm okay. But I know there are other people who are still hesitant about taking it. And I'm glad you brought this up, because I was thinking that, okay, we're dealing with Delta, but I remember months ago they changed everything, the namings to the Greek
alphabet, right?
A, B, C, D. And I thought, well, if we're already on D and people aren't vaccinated or getting their needles, does that mean we have the potential of an E? I don't know what that is, epsilon or
epsilon, right?
Oh, it is.
Yeah, there already is an epsilon. There already is an epsilon. We're already up to L. Actually, we're up to lambda.
Really?
Yeah.
Okay. I haven't heard too much about anything like that. But
we're moving quite along in the alphabet.
Yikes. Okay, that's even more worrisome.
So I think the thing that your listeners need to be aware of is that there is the potential, if this doesn't happen, that would be a great thing, but it's something that's really concerning a lot of infectious disease and epidemiologists, because we are, again, in this very tenuous position of a lot of partially vaccinated people and a fair number of immunocompromised. And that's a big issue. The next one, I think you mentioned this earlier about kids back in school. Here in the US, schools already started in many parts of the country, and kids are going back. So remember that here in the United States, I don't know about Canada, I'm assuming it might be similar, is that you can't vaccinate kids that are under the age of 12.
Yeah.
So that means you have a lot of kids in school that are not going to be vaccinated. So the average age of kids being hospitalized with COVID, as I mentioned earlier, is starting to drop. And so in the first week of August, there were 203 kids under the age of 18 that were admitted in hospitals here in the United States. And that is just only slightly below the peak of January 2021. So we're seeing a lot more sick kids. And the other thing that we have is that we don't have a big uptake in adolescents taking the vaccine here in the US. Only less than 5% of the adolescents in the US are fully vaccinated. How about in Canada? Do you have any sense about what the age breakdown is where you are?
It is the same, 12 years
Mhm.
old and up. I do know, speaking with my niece who just turned 12 about a week ago, she had her needle on her birthday. And
Good for her. What
you
a
know what?
role
She was
model.
happy. She was quite happy. She goes, thank goodness, I now have my needle. And she's waiting to get her next one.
Mhm.
Her friends that are around the same age and that she goes to school with are also getting their needles.
Great.
And I don't know if it's maybe a rural thing and, but they're seeing, I don't hear about people that live out in the country doing it, but people in the cities I'm
Mhm.
hearing are doing it.
That's good.
So I don't know enough people to kind of ask about
Mhm. Mhm.
what's happening in the thinking, with people that live out in the country, maybe because they don't come across as many people as people in the
Mhm.
city do. So maybe that's part of it. But uh, 12 and up can get a shot, but I think it's only the Pfizer shot for
Right.
now.
Only Pfizer. Right.
Yeah. And so the same thing is happening. And adolescents, people 16, 17, 18, I have read reports that, they're in that mentality that, we had when we were that age, nothing can hurt me.
Right.
So
Right. Right.
there is still a large group of them not getting vaccinated.
Mhm.
They think they're impervious to everything, and
Mhm.
that's just
Mhm.
the way the teenage mind works.
Absolutely,
you know.
absolutely. When you mentioned the difference here between in Canada between rural uptake of vaccines versus urban centers, we have the same thing in the United States. The urban centers are much more vaccinated than the rural centers, and our rural areas are much more conservative politically. And there's a huge difference in the United States between conservative individuals and more liberal leaning, I suppose, in getting vaccinated. The thing I think is, and you see that with also with schools and rules about vaccines for adolescents, but also rules about masking. And I'm sure you've been following in the United States, there's a variety of states, Texas in particular, and Florida, where the governors have created mandates that schools cannot mandate vaccines, they cannot mandate masks. And so that's become a huge issue, of which there was just actually a news piece I just saw that two school boards in Florida are being reprimanded by the state school board because they went against the governor's mandate for masks and wanted masks on every kid. So I think this is going to really play out in some challenging ways this fall with more kids getting sick. There was already a school district that opened and they already closed within 1 week in Florida because they had a large number of students that turned positive. So
Mhm.
I think that's going to be a big issue as we get into the fall. And just think about what we talked about last year, all the people with kids, all the workers with kids that are now potentially having to do homeschooling with
Yeah.
Zoom. And I think that's a potential for this fall as well,
Yeah,
sadly.
a lot of the same things are happening up here. Just yesterday or today, I forget what it was, but the Toronto District School Board and a few others released their recommendations as well, and they are telling everyone if you're going to school, teachers have to be vaccinated,
Mhm.
uh,
Right.
students have to wear masks. You're not going to have the big cafeteria gatherings.
Mhm. Mhm.
Everyone, if you're eating lunch, you have to eat it in your classroom and stay with your class. Their students were given the option of going to school or continuing learning from home. And I think
Mhm.
there was about 20% that still wanted to stay at home. And now with looking ahead with the way the Delta variant is heading, that there's already grumblings, shall we say, about going back to, it's too risky to bring kids in
Right.
to schools now because it's kids that are, or I shouldn't say kids, but it's the younger population that are
Can't be
now more
vaccinated.
vulnerable, yeah, that can't be
Right.
vaccinated and are now more vulnerable.
Mhm.
You
Mhm.
might have been able to take a risk before, but now you can't take that risk.
Right. Right.
So it'll be interesting to see what happens. And I know in Alberta, and I hate to pick on Alberta because I know I mentioned them earlier,
You
but
are, you're picking on them.
I don't mean to, but they had suggested a while back that when schools start, there won't be mask mandates. They're going to open everything up. Well, they've now taken a step back and they are changing their mind, saying, yeah, okay, maybe students should be wearing masks, and maybe we shouldn't be opening all this stuff. And now they're starting to rethink their strategy based on what's happening with the vulnerable population right now.
Yeah, the whole mask issue, again, has been politicized in the US the entire pandemic. But I think what people need to think about with kids in particular is that there's source control, which means if I'm the infected person, if a source control is where I'm wearing a mask and I'm retaining most of that virus with me, but then also with the fact that Delta spreads so easily, the fact that everybody around me, even if I am masked and potentially sick, although I wouldn't know it, everybody around me wearing a mask just increases the security and safety exponentially. And it's just such a simple thing to do.
Yeah. It'll be interesting to see if anyone does start changing over the next week, because I know you mentioned in the US people are back in school or have already opened. We don't open our schools officially until the day after Labor Day. So I think this year that's September 7th.
Yeah, so we used to do that years ago, and then they decided somehow that summer was a good time to open. I don't know why. Yeah, I don't have kids, so I don't know all the reasons and rationale for this, but
well, north of the border, we don't get a lot of warm weather for extended periods. So, so we definitely keep our summers open for, camping and things like that. But it'll be interesting to see what happens in the next 2 to 3 weeks as that date approaches.
There's two other things I wanted to mention about why we're in kind of a precarious position as well. The vaccine potency is beginning to diminish already for the healthcare workers. They actually got their vaccines first. They started in December of last year in the United States. And so again, what they've actually observed in Israel and some other studies with Pfizer and Moderna is that the efficacy of the vaccine is diminishing over time. So there's been studies that say it gets down to 84%. Some of the studies out of Israel said it went down to 60% after about 6 months. There's also increased cases occurring now in vaccinated healthcare professionals, which begin to also, not only does the research in a test tube show that the efficacy of the vaccine diminishes over time, but we're actually seeing that in healthcare workers. But again, remember, Delta is much more infectious. People are producing a much higher viral load. And of course, their work is where even though they're fully suited up, there's always the potential of exposure. So again, hospitals are a kind of a little bit of a test tube, if you will, as people again are tired, they're burned out, they're working long shifts. There's always a potential when people get tired and burned out that they are not maybe as appropriate in all of their processes. So maybe there's that going on as well. But the fact that the efficacy of the vaccine is diminishing means we have more people that are being exposed potentially. And as you might have heard, that Biden actually approved third doses for healthcare workers, for people in long-term care, and for people over the age of 65, starting on September 20th, I believe, which is really trying to really fulfill these healthcare workers in particular. And then, of course, winter's coming, and what happens in the winter? Well, you know better than anybody where you live. My gosh, that everybody goes inside, and so SARS-CoV-2 happens to like a drier environment. So you take forced heat in a building, dries out the air, the humidity drops down, it makes it a little happier. It's a lot easier to spread when people are more clustered together in a home. And so the idea that you've got low humidity, you've got people that are closer together, and if you're in a poorly ventilated space, remember this is an aerosol-borne disease, it's all about transmission, and being able to pass it easily from one person to the next. And so if we are in a situation in a closed environment like somebody's living room and everybody's vaccinated, but somebody could have picked it up and they're very close to you, you could easily become infected. And so the winter is going to be, I think, potentially a big challenge for us.
If we don't get a grip on things basically immediately,
right,
we could have another wave like we had last winter.
Which would be horrific.
Devastating, absolutely devastating, I think.
And it won't be the old people so much that are getting really super sick. It's going to be younger people.
Right. I also have a concern for all the healthcare workers. How much longer can they keep going?
I'm deeply concerned about them. I am deeply concerned about them. They're just burned out, fried, and angry at people that are not getting vaccinated and people that are doing inappropriate behaviors.
Yeah, yeah. I really feel for them, and I
Mhm.
know. I think it was maybe 4 or 5 episodes ago. I talked about a survey where up to 30%, at least 30, it was 30 or 40% of people in that industry want to change their job or leave their job altogether.
Mhm.
Well, what's going to happen for the poor person in a year from now who's in an accident, or that a person that gets shot? So that the example you used earlier on,
Mhm.
there's literally going to be no one. There might be a bed, but there's no one to look after
Or
them.
staff. And a bed doesn't do you much good unless you have good professionally trained staff.
Exactly, exactly.
Mhm.
And I think on that note, we've come to the end of our second segment. We are talking with Regina Phelps, and we will be right back. And welcome back. Today we are talking with Regina Phelps about COVID variants, the Delta variant, and where we are. Regina, I know you still got a few more points you want to bring forward, and
Mhm.
what's the next happy thing you want to tell us?
Yeah, I'm just full of such good news today, aren't I? What I was really talking about is all the things that we should be losing sleep over. And there's really two more that I think that are really important to really mention. And that is that most of the world is not vaccinated. And I know we have talked about this many, 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 many times, but the rich countries have pretty much consumed 3/4 of all the vaccine that has been given to date. And so less than a third of the population of the world has access to vaccine. And you see that certainly when you look at the map of Africa. There are many countries in Africa that have less than 1% of their population vaccinated. And so there's two reasons that we should be deeply concerned about this. One, of course, the blatantly obvious one is the humanitarian issue, the sheer amount of pain and suffering of many of these countries with very low vaccines. You're seeing that right now in Indonesia, which is the fourth largest populated country in the world, where people are dropping like flies and they are building gigantic cemeteries with big backhoes because they're having such an incredibly high death rate right now. And the second really issue that we should be thinking about besides humanitarian is the issue related to the fact that we are doing it strategically to protect our vaccines. Any place in the world where you have widespread transmission, you have the opportunity for variants to occur. Where did Delta come from? India. So remember that it's not just what is brewed in your backyard that you should be concerned about. You should be thinking about variants and the lack of vaccines all over the world. So if we continue to hoard vaccine in the wealthier countries, the pandemic will not be over. And secondarily, we are always at risk for having a significant variant appear someplace else in the world and ending up in your backyard. So that's a huge issue to think about going forward.
Mhm.
I'm going to leave this sort of one segment of talking about, what could happen going forward. This is actually the modeling group, COVID-19 modeling hub that actually CDC uses for its forecasting. And so there's basically 4 different versions of this particular map. I'm going to have you focus really the one that's on the lower left-hand side. What you see when you see the graph with the little circles in it, that's really where we are right now. And you can see where we were in the winter. That's that big far peak that you see to the far left-hand side. The different grays that you see in this model are what could potentially happen. And what you see in the lower right-hand side is low vaccination with high transmission, which is what we're doing right now in the US. So I want you to think about where we are. Look at the black line with the little dots and look at the dark gray example that you see. That's where we could go again.
Yeah,
And so what you'll see is that would be essentially leading where we are now. We're actually ahead of the model. That's never good, by the way, Alex, to be ahead of the model. And we're ahead of the model. And you can see if we continued with high transmission and low vaccine rates here in the US, we would look like that. And we would be very close to what we looked like last winter. And so again, this does not have to happen. If we had a higher vaccine uptake in the US, we would expect those numbers to look more like the top left-hand side, which is low transmission with high vaccine rates. And as you can see, if that was to happen, that big peak doesn't occur. And so that's what we really need to think about. I'm sure probably your modeling, if I was to see yours for Canada, would be very, very similar.
Yeah.
But, people say, well, what should I be thinking about for the fall, late summer, fall and winter? You can see the options here, and it's all based on vaccine and transmission.
It begs the question just to ask people, haven't you learned anything? We're on a fourth wave. Have you learned nothing?
Right. Yeah. The lack of interest in science and the way that people hold on to their beliefs of information that they've found on Facebook and Twitter, I still don't understand. And I work really hard to talk with people with as much compassion as I can possibly muster to listen to what they have to say. But I find it really frustrating. It's almost like, well, excuse me, if you were having open heart surgery, would you talk to your uncle on Facebook about what he thinks you should do? I mean, wouldn't you go to the Mayo Clinic website and ask them what you should do? I mean, really?
Or a vaccine that cures all cancer?
Yeah, right.
Would you be acting the same way?
Right. Yeah, it makes me crazy.
Yeah.
But anyway, that's a little preview for your listeners to think about. We have some choices here to make. And if we make some better choices, we could have a less painful future. If we make poor choices, the future is not so great as far as the amount of cases, which then ultimately leads to hospitalizations and deaths, as we well know.
Yeah.
And possibly long COVID. So I know we want to talk a little bit about long COVID. Do you mind if I just jump right in?
Sure.
Well, the hard thing about the coronavirus is that it's not like the flu. And remember, everybody say, oh, it's just like the flu. No. It's not, and it's primarily not because of the type of infection that it creates in a certain group of cells in your body, and those are called ACE2 cells. ACE2 cells are present in your human body in many places, not just the lungs. It's present in pretty much all of the brain, all of the neurological system, all of your blood vessels, and through your entire gastrointestinal system. So when you look at long COVID and you look at the types of symptoms that people have, which range greatly from things like brain fog and cardiovascular disease and clots in their legs, etc., it's because of the different cells that the virus actually attacks. And that's why long COVID is such a big deal. What's defined as long COVID is if you actually have symptoms that persist for 4 weeks after you have been infected. So you'll see a lot of people that will have continuous brain fog that doesn't get any better for months, or things such as shortness of breath after walking a short amount of distance. They would then be categorized as long COVID. About 10% of the people that are infected, whether they were seriously ill or were even asymptomatic, can actually develop long COVID. I've actually seen studies as high as 20% of the people that get COVID, but certainly the most common number I see is 10%. Now, it's not just people that are older, although that's certainly been a group of people with long COVID, also people with compromised immune systems. It can be simply people that just got sick.
Well, that could change now, right? Because the previous waves was I don't want to say older people, but
right.
It's not kids, but now we're dealing with Delta variant, which is a younger populace being infected. Now the younger generations could be impacted by this, or
absolutely. And you're seeing kids right now with long COVID. Kids,
wow,
who can't walk across the street because they're short of breath. It interestingly affects more women than men statistically. And that's not uncommon. There are other kind of viral syndromes like this that affect more women than men. And it has to do something with reproduction and the effect that has on our immune system overall compared to men. but it's a few more percentage points women than men. But other than that, it's pretty much equal across the board. There are a bunch of symptoms and areas of the body that are affected. So there is now a medical term for what long COVID is. It's PASC, which essentially is post-acute sequela of COVID-19. That's the medical diagnosis, but everybody calls it long COVID because it's just easier. And you can just see from this slide, there are a lot of things that can be impacted. First of all, in your pulmonary system. So shortness of breath, dyspnea, people that can't walk any distance at all without being acutely short of breath. And that's actually a significant and one of the most common side effects in long COVID is this persistent shortness of breath. 40 to 60% plus of people with long COVID have severe problems with their breathing. But there's a fair number of cardiac issues as well. So for example, things like chest pain, palpitations, inflammation of the heart muscle. You've seen that as a side effect of the virus or of the vaccine in some cases. It's what the virus does to you naturally will be inflame your heart. There have been people that have had things such as rapid heartbeat. There have been heart attacks. So a lot of cardiac symptoms. Hematologically, it causes clotting. And so you'll have people that will have pulmonary embolisms, strokes, which of course are caused often by clotting, but also deep deep leg thrombosis. So you have a clot in your leg. So that's all significant issues. Hematologically, that's a concern because you'll have people that can again have these going on for long periods of time. The neuropsychiatric ones are really fascinating and unfortunately really scary. So this chronic malaise where people have no energy at all. Malaise, which they again they have body aches all over their body for no particular reason. Depression. Poor sleep. So they may be able to sleep all night, but they wake up and they don't feel rested at all. Brain fog is really, really common. And you hear people often with long COVID complain about not able to remember things, not able to keep things in their brain, forgetting stuff, almost as if you think that they had early dementia. Migraine headaches, and also some psychiatric symptoms where people actually start acting unusually. And then lastly, if that wasn't enough already, is renal related issues. And this is where, again, think of the clotting. You know, your kidneys actually are filled with small little blood vessels, and they can actually, again, be filled with clots in this long COVID syndrome. And so they actually have severe kidney damage, and they end up on dialysis. So those are actually really significant. And we can talk about this when I see you next month, I think.
Yes, because we've come to the end of our show. And wow.
Sorry for leaving on such a bummer, huh?
Well, just when we think we're taking a step forward in some areas, we just keep getting drawn back into, the not so happy areas. But this is reality. This is what we've got to really focus on to be able to move forward.
Absolutely.
Regina, thanks again for sharing your expertise and time. There was, I know I've made the joke, the rosy information and, all the happy things you were telling us, but, I think people really need to understand this stuff, as we move forward and why it's happening. So I really appreciate you educating us on some of this information.
You're welcome. And we'll talk more next month, I bet.
We will. And we'll touch on long COVID again as well. And to everybody listening and watching, stay prepared, everybody. If you liked that video, thumbs up. If you didn't like that video, thumbs down. But leave a message and let me know what your thoughts are. If you'd like to be a guest on the show to talk about something related to business continuity, disaster management, COVID, personal well-being, anything that's relatable to those subjects, you can reach me through my LinkedIn profile, which is in the video description. And of course, don't forget to subscribe. In the meantime, stay prepared, everybody.